Here are my 3 audience members for my speech. Stop laughing. Tell me when you are ready.
Ready.
Okay. To breast or not to breast? That is the name of my speech. Okay. So the purpose of this speech is to persuade anybody who has thought about breastfeeding, tried breastfeeding before, or who's, just a little bit curious about exactly what you do, how it goes on. Maybe you thought about doing it and someone talked you out of it, but you just don't have enough information. So mainly this is to just persuade you to give it a try. Not necessarily to tell anyone else that if you're formula feeding that you need to quit and you need to start breastfeeding. That's not my purpose. The purpose is if, like I said, you thought about doing it, you wanted to give it a try, you formula fed before, and now you want to try breastfeeding and you weren't successful. That's the purpose of this, is to give you a little information and help you out with that. Okay, according to the U.S. national breastfeeding rates, the U.S. is the lowest percentage of breastfeeding women in the world. While most other countries are at 98%, the U.S. is at, according to this chart, 70%, and that's from birth to 1 week. And anything past that, it drops down to the 60th and 50th percentile. So a lot of women, I'll get a little more into it later, but a lot of women choose not to do it, like I said, because they're uninformed, misinformed, or they're just not educated on the topic. I myself have formula fed 2 babies, and I breastfed my last, and I really felt like I wasn't informed. I didn't have the right tools, I didn't have the support system, so that's why I wasn't successful the first 2 times. And the last time I was successful because I did a lot of research, I took a lot of classes, and I talked to a lot of people. That way I would be successful in doing it. But I forgot to mention, we have started, this is an older chart, this is like from 2008. So there has been an increase since 2000, this is the most up-to-date chart that I found, but there has been a slight increase, and I hear about it more and more every day, so I definitely think it's starting to become more popular. Okay, so some of the pros and cons, obviously, if you didn't already know, one of the pros is the health benefits, which I'll get into that a little bit later on another slide, but it's economical. So breast milk is free. If you're getting it straight from the tap, it's free. You don't have to pay anything. Now, if you do plan on doing something else like pumping, you would have to get the tools, a pump, or a lot of times you can get them from the WIC office for free, you can borrow, and a lot now, insurance covers a lot of pumps, or you can rent one or borrow one from the hospital. So if you are getting it straight from the source, like I said, it is very economical. Efficiency. You don't have to get up in the middle of the night and stumble around and go downstairs, make the bottle, pour the milk, warm it up. You don't have to do all that. Pretty much, you just pull it out and you nurse your baby. And, you're going to get, as much sleep as a normal new parent would be, but you find some little tricks whenever you are nursing, you're not sitting, trying to keep your eyes open with the bottle. You learn to lay on your side and nurse. You sleep, baby sleeps, so it works out a little bit better. Like I said, you don't get much sleep when you have a newborn, but it helps you get a little bit more rest because you're able to do that. Nutrition, your milk, it changes, it adapts to what it knows the baby needs. So it has all the nutritional value already in there. You don't need to supplement with iron or vitamin D or any of that because it's already in there. Okay? Some of the cons are, as I said, you're the source. So that can be a downfall to some people. You can't necessarily hand off the baby and ask somebody else to nurse your baby. Your husband can't nurse the baby in the middle of the night. So that is one of the downfalls. If I have to have a cons list, that would be on there. I do have a cons list, but that's on there. Okay, certain medications cannot be taken. This is my reasoning for not nursing my second child. I was told by my doctor that the medication I was on for my morning sickness, I had to wear like a special patch behind my ear because no medications were helping. I was told that it was harmful to the baby, and it would pass through my milk stream, and it would stay in my body for a while after having her. So I went ahead and said, okay, and I took it, you know, as what the doctor said, because you think your doctor's knowledgeable. But what I later found out, whenever I went to a licensed lactation nurse, is that they can switch your medicines, and they could have given me something different, so I could have. Or they could have checked that medication and seen that it actually was safe, and I could have nursed my second daughter with that medication. Because when you think about it, you do, after you have a child, you take a lot of pain medications and all the other stuff that they give you, and it's perfectly safe. As long as you check it out, make sure it's safe. There are some websites, Kelly Mom is one of them. It has a list of medications. It tells you if they're safe, it tells you if they're not, and of course, always check with your doctor. Like I said, my doctor wasn't very knowledgeable. Some are more knowledgeable than others, but always check with your doctor first. Okay, getting help. So like I said, there's so much information out there, there's so much help, and you just have to be resourceful and you have to find the help. One of the things that you can do is you can contact your local La Leche chapter, which is a group of nursing moms. They usually do meetups and they do classes, and they're always willing to help. Might be a little awkward at first because, you know, it's so natural and normal to them that they might even offer to help you position the baby on your breast. And at first you might think it's a little weird, but like I said, it's all natural. Nobody's thinking of it in a sexual way, so once you can get past that, it's good. They're really good for helping. Another source is an IBCLC. That's an International Board Certified Lactation Consultant. Now, when you're looking for a lactation consultant, you want to make sure that they are internationally board certified. And they do offer classes. I actually took a class with one of them, and it was the most information I had ever learned. She told me the downfalls. You know, they didn't really sugarcoat anything, because I will say this is probably one of the hardest things that I've ever done, but it was so worth it. And they will tell you, your baby will nurse probably 24/7, round the clock, till they're about 2 or 3 months old, and it's all completely normal. So when in doubt, you can always contact a lactation consultant, the La Leche chapter, or you can go and check with your local hospital. They also offer classes, and they usually have a lactation consultant employed there at the hospital. Another resource is the WIC office. Oh, let me see what this is. Oh, another is the WIC office. I'm not sure about all WIC offices, but my last one, they also did offer breastfeeding classes, as well as they offered the pump for rental for free for students or for working moms. So those are all great resources that you can check out. And you'll meet all kinds of moms that are always willing to help, because, you know, that's what it's about. It's about helping each other out. Okay, controversy. So this is one of the big reasons that I think a lot of people feel uncomfortable breastfeeding. So here you'll see, just in case you're wondering what these pictures are, this is a picture of a mom nursing her baby. You see the baby's head. You see no skin. Now this is a picture of a celebrity with everyday wear, and you see more breast on her than you do on the actual mom that's feeding her baby. So I personally, when I'm out and about, I see more breast on women with normal clothes than I do when I see a mom that's nursing. Most of the time it just looks like the baby's sleeping. So unless you're really focusing and trying to pay attention to what they're doing, most of the time you can't even tell what's going on. Another controversy is the breast is best campaign. A lot of people mistake the breast is best campaign as breastfeeding moms saying that they're better than everybody else because they breastfed. Not true, just the name of the campaign. Kind of like the Black Lives Matter campaign that's going on right now. Yes, we know all lives matter. It's just an actual name of the campaign. The Breast is Best campaign. So, it's not to say that if you're a formula feeding mom that you're no good and a breastfeeding mom is better. No, that's not what it's about. But we do know that breastfeeding and breast milk is actually better for your baby. Anything that's synthetic, anything that's had to been produced and made with chemicals and unnatural things, of course, it's not going to be as good as the natural thing that's coming straight from the mom. I already talked about public breastfeeding and the controversies there. And the last thing is covering up. This has been a huge topic. So a lot of people feel that if you're a mom and you're out and about and nursing, that you should cover up. They don't want to see it, so it should be covered up. So I totally agree. Here's a perfect example. If you see a breastfeeding mom, what you should do. If you don't like it, feel free to cover up. Okay, back to the seriousness. So, would you want to sleep with this over your head? Not sleep. Would you want to eat with this over your head? I definitely wouldn't want to eat with a blanket over my head. So there's no reason for us to think that a baby would want to eat with a blanket over their head. It doesn't matter how thin it is. It doesn't matter how cool it is. They get hot. They get sweaty. Mom gets hot and sweaty. It's a gross feeling. Nobody wants to eat in the dark. So next time you're thinking, hey, maybe that mom should cover up, because like I said, you really don't see anything unless you're really checking them out. But unless you want to sleep with a cover, I keep saying sleep, you want to eat with a cover over your head, don't expect a mom to do it. It's hot, it's uncomfortable, the babies don't like it. The babies most of the time push it off, so don't ask them to do it. If you think about asking them, like I said, put the blanket on your head, go eat your dinner, go sit outside in the 100-degree weather, and try to eat with the blanket on your head and see how it feels. Okay, so I told you we were going to talk about the health benefits to babies. One of the best health benefits is the colostrum, which they call liquid gold. That is the very first breast milk that the baby gets, the very first milk that comes in, and it is rich in nutrients and antibodies. So doctors will tell you, if you don't plan on breastfeeding, if you can't breastfeed, and I do the quotes because usually it's not true, they will tell you that your milk will come in, that you didn't make enough milk, but there are so many ways around that. There's so many ways to fix that. A lot of times that's often not even the case. So that's why I say go talk to a certified lactation consultant, and there are so many ways that they can help you. Okay, so if you can't do it, or you don't want to do it, at least the best thing to do is to let your baby get that first milk, the colostrum. Another health benefit to the baby is the milk changes to meet the baby's nutritional needs. Now, like I told you before, it has everything that it needs already. So as they age, as they need more, you produce more, whatever antibodies they need, whatever, the baby needs it, your milk's going to change to meet their needs. It is easier to digest. I know this for a fact. Okay, when you have a formula feeding baby, they have all kinds of gas and tummy issues. When you have a breastfed baby, they eat, and they poop right away. No problem, comes right on out. So that's one of the perks as well. They also have a lower risk of respiratory infections, lower risk of atopic dermatitis, lower risk of ear infections, lower risk of type 1 and type 2 diabetes, and it lowers the risk of SIDS. I will vouch for all of them, but to make it a little more personal, the respiratory infections and ear infections. My 2 formula-fed babies, they were constantly in and out of the doctor. My first daughter had all kinds of colds and respiratory infections. My second daughter had ear infections all the time. Whereas my breastfed baby, I can't think of a time that I took him to the doctor for any kind of respiratory illness, for any fever, ear infections, none of that. So that is true. I will vouch for that. I had something else to add. Okay, what's going next? Maybe I'll think of it. Okay, health benefits to mom. Lowers risk of type 2 diabetes, lowers the risk of breast cancer, lowers the risk of ovarian cancer, lowers risk of postpartum depression, and quicker weight loss by burning calories. I don't know about that one. I will say in the beginning, the weight came off really fast, but I was always starving. So you burn so many calories when you're feeding your baby that you just want to replenish them. So I can't say it's true, but it might work for some. All right. So the last thing I want to say is, like I said, this is not to say that a breastfeeding mom is better than a formula feeding mom. This was just to get the information out there, tell you your resources to get help, tell you some of the benefits, some of the reasons why women might not want to feed their babies or breastfeed their babies because of the controversy. But always know too that you have rights. You are allowed to feed your baby in public. Every country, every state has different laws, so just always be sure to check out those laws, and you're going to get more support than you will people against it. And that was the last thing I want to say. You need a support system so bad. You need people that are going to encourage you, that are not going to run out and try and buy you formula, because believe me, I asked my husband many times in the middle of the night to go out and buy me some formula, and he refused. So check your resources, get the support you need, and I hope this information was helpful to anybody who's been thinking about it, who's been misinformed or uninformed. And that's it. Thanks. Have a good day.